The second part of my talk is in regards to exercise. And my famous question is, well, why do I need to do this? I'm fine watching TV. I learned that I shouldn't eat chips and all that, but sedentary. Should I hit the gym? Should I start being active? Is that of any use for me? Why does the doctor even say that all the time? And we have observational studies which prove that regular exercise and regular physical activity actually decreases coronary artery disease and decreases the risk of a primary cardiac arrest, like a heart that stops. It is important to mention that all these observations that I'm going to give now are valid across age. It doesn't matter, young, old. It doesn't matter if you're a man or a woman. It doesn't matter the race or the ethnicity that you have. They're valid for everybody. And there's studies and studies and studies that prove this over and over again in men, in women, in any categories. Exercise not just improves your cardiovascular status. I want to go a little bit beyond that and stress the fact that it makes you feel better. It decreases the lipids, improves the lipid profile and the balance, the appropriate balance of lipids that we need in our blood. It improves the blood pressure. It helps with diabetes treatment and possibly would prevent diabetes. It reduces the inflammation, and more so, it reduces the risk of cancers. For instance, cancers doctors, the way I as a heart doctor recommend regular exercise, their society also recommends regular exercise to decrease risks of cancer. Then it decreases the chances of obesity. It tries to prevent obesity. It helps with smoking cessation. It helps with function and cognition. It reduces stress, anxiety, and depression. And for each of these statements, again, I place the appropriate studies that give us hints that this works or that this really works. Now, here's the slide that wants to answer the yes and no question. Should I stay on my couch and watch TV, or should I just go ahead and be physically active? In the red bar, you see here the coronary events in patients who are sedentary. The darker blue bar shows you that patient that even lightly exert themselves, just lightly exertion, very close to sedentary maybe, already have a decrease in cardiovascular events. These are persons who have never had any cardiac disease in their past. We call this primary prevention. Now, how about I start exerting myself moderately? And I show clearly a further improvement and a further reduction in coronary events in patients, even as opposed to patients who have some light physical activities. Needless to say that if I would compare this with the red column of an inactive patient, this light blue color almost or a little bit more than halves the risks of coronary artery events in time. Studies show this over and over. For instance, this study performed on women shows that the more you exert yourself, the lower the chance of cardiovascular problems in past. So be active. The more active, the better. The other important thing is, well, imagine I'm 60. I haven't done much. I didn't exert myself much. Why would I do this? I mean, most of my life is over. Am I going to make a difference? And studies showed again, not just one, this is one of the prototype studies that show this, that becoming active even midlife or later, it further decreases the risk of cardiovascular events. So the battle is never lost. One should never give up with thoughts like that. How about in patients who already have an established heart vessel disease? For instance, I'm presenting here patients who had a heart attack. Is it useful to undergo rehab after a heart attack? And this study shows the answer to that. Without the rehab, and patients who do undergo a structured regular rehab. Look at the difference. It is statistically significant. It does make a difference. In what? Well, in death. It's not just a small surrogate endpoint that we're talking about here. So an important thing for us to remember and to recommend to our patients. Our hospital does have a valid and very robust rehab department that regularly helps our patients. Now, yes, exercise, the more the better. How much? What are the current recommendations for exercise? So the American College of Cardiology and the American Heart Association together are giving exercise the highest recommendation that we should that should be given. It is recommended that for at least 5 days per week, we exert ourselves regularly, 30 up to 60 minutes per day. How tough should that be? Well, moderate regular physical activity is the one that is recommended. specifically what? And my answer is whatever you like to do, whatever you enjoy doing. It can be walking, it can be walking outside, weather allowing or permitting, walking through a mall, walking through a closed space, treadmilling, jogging, a stationary ergometer or bicycle, active yard work, or dancing can also be seen there, as long as you fulfill as long as the recommendations that I mentioned above have been fulfilled. Do you need just a single one? No, it can be any of them combined or together. How about persons who have that low back pain or to have the joint problems? Well, as long as it is safe for them, I recommend them to use a swimming pool. You can do water aerobics, you can walk through water. Persons who can swim are encouraged to swim. Again, it is about maintaining health, but the water sustains your body weight, and thus it puts less pressure on your joints, and you might be able to do that if you're not able to walk outside. How do I know that I achieved a decent endpoint? Where timing is an endpoint. The recommendations, the society recommendation that I just gave now is an endpoint. The society at this level for healthy heart style does not recommend that we go to a certain maximum heart rate levels or not. It's just sustaining moderate physical activity. And then we can also recognize that, well, breaking a sweat or getting some musculoskeletal fatigue, muscle tiredness, getting some breathlessness would be endpoints that we want to think about achieving. Clearly, for persons who are sedentary and have not done this for a while, they need to see their primary care physician. They need to see a cardiologist to see whether they are fit to undergo such changes. All of a sudden, jumping in physical activities might be overdoing it and might predispose us to injuries and risk. And injuries are such a setback for physical activities. You want to avoid those. As long as they pass through patients that I see, and as long as they pass through my filter of questioning and seeing whether they need further tests or not, I always recommend them to ramp themselves up slowly. This is not a process that should happen within a week or within a day or so. This is something that can take a few weeks just to get up there to the recommendations that the American Heart Association, American College of Cardiology joint together have made. The final advices in regards to motivation. Well, the talk that I gave so far tries to motivate us all of why do we say diet, why do we say exercise, why does the doctor insist so much every time on doing these and implementing these changes? And I hope the slides and the data speaks for itself. However, other little tricks and other little ideas to give. The attitude is the most important thing. Have a positive attitude. Create yourself a personal list. Each individual is different. For instance, I want to be able to climb up those flights of stairs without huffing and puffing. I'm sick of all this. I want to feel fit and healthy. Or I want to be able to play with my grandchildren. I want to run after them. There's a list. And there's so many more other reasons that one would like to think about either dieting or exercising. Team up, for instance, husband and wife or friends. If you do this together as being an isolated, single, weirdo individual, if I may say so, just team up. Get someone that has the same ideas and the same thoughts. Or make your spouse and wife have the same thoughts with you. Show them these, talk to them about what you learned out of these slides. And then go to the gym together or exercise yourselves together. Or find the joy of maybe buying food or finding new recipes or cooking a food together. It makes fun. You spend more time with your dear ones too, and you're getting healthier as well. How about making it as enjoyable as possible? Well, yeah, if I want to go to the gym, I might want to put my music on, my preferred tunes or whatever it is. I might listen to audiobooks. I might watch TV if I'm interested in a show or in news or anything of that sort while I do that time. So this way I'm doubling using that time. Or I might just prefer an absolute silence. And finally, I have a day during the day where I'm just enjoying, like, say, walking outside and listening to the birds or going to a gym or putting some earplugs in, final silence. You can also motivate yourself by, for instance, buying new sports shoes or buying new equipment, anything that you like. How about food? Well, buy some new cookware, if that motivates. Buy yourself a new cookbook. There's a whole amount of information, a whole amount of data on the website of what recommendations are made and what are the foods to do and use. And for instance, recommendations for heart-healthy diets, such as the Mediterranean type of a diet. Make a specific plan. You're going to say exactly like we many times recommend with smoking. Set a specific date. This is the first day when I'm going to start doing it. No more. I'm closing the door on everything that happened so far, and I'm going to make a plan how to slowly ramp myself up. How specifically I'm going to do this? What are my goals? For instance, in younger, healthier persons, one of the things that might stimulate, well, do I want to run a 5K? Do I want to run a marathon? Well, I'm going to ramp myself up, and at the end of the next 6 to 9 months, this is the marathon that I want to go to, or this is the race that I want to go to, or a walking, you know, for all sorts of reasons that are all the time organized. So put yourself a goal. Make a goal for yourself. You can reward yourself. Every time that you go to a gym, you can put in your piggy bank a certain amount of money, and then at the end you have some money and you're going to make something with it, something that you like. And look at it again with a positive attitude. Look at it always when you want to implement these changes, to be strong in going with them. Think about this. This is the unhealthiest that I've ever been so far. From here on, I'm going to do all these changes. I'm closing the door over everything and in the nose of everything that has happened so far. And I'm going to start a new life. How's that? To help further, I want to say that there's a whole amount of information like I anticipated before. The American Heart Association has dedicated website that has whole teams that work at this and try to help our population obviously for free, giving advices for lifestyle, for exercise, for diets. And here's, it's one of the websites that I would recommend, and here's a long link, but just try to Google American Heart Association and diet, and it'll get you there. It'll get you to the right website, and there's much more than what I just say today, things that we can all learn and implement to get a healthier heart by improving our diets and starting to be active. Thank you for listening to this lecture.